Hi, I'm Chuck Parker. I'm the Executive Director of the Continua Health Alliance, a not-for-profit association focused on interoperability of personal health care devices. We have a long-standing partnership with the GSMA and also have worked very closely with the mHealth Alliance on a lot of activities here around the use of mobile health technologies, or what we refer to as personal connected health. So it's really about driving that aspect, and how can we play an important part in help drive that aspect forward as one of the strong partners here. So I've been involved in the Alliance now for the last 3 years, but my background's been in IT. I've been in healthcare IT for the last 13 years, and IT for the last 20 plus years, so I've sort of been around this technology for quite some time. Previous to this, I was working in the electronic health record space on the adoption of electronic medical records, so I think it's been quite an important aspect. This is sort of the next step in, once you automate the physician office, now it's becoming, how do you begin to automate that process even further and bring technology closer to the consumer in this case. Truly it's about the consumer, and we hear more and more about consumerism and the power of the consumer and being able to work with the patient directly. And this is sort of that next step of being able to bring the patient into the cycle. Obviously, I'm going to say interoperability. I think that when you take a look at the interoperability aspects of our plug and play, and make it a simpler word, making sure that these devices can connect easily, that people can connect them and use them relatively easily, makes it a much easier, a much overall better effect for the whole system itself. Not only from a systems perspective, in the sense that I can now connect multiple devices together to create these unique, perhaps even different types of services, but the fact that even consumers will be able to plug them together and make them relatively easy. So, what we have here is this is just a standard. This is a standard phone, Google phone. In this case, this is a Samsung phone. Not necessarily required to have the nicest phone, but this is one that relatively straightforward. So we're going to log in via. We have it. So using our standard interface here, we download an application. The important thing to note is that this is running Ice Cream Sandwich, which is the 4.0 version of, the latest version of the Android operating system, which has a native capability now to run these applications in a secure fashion. So we'll click on an application here, I'll bring up the application. I'm going to use a simple device here called a PulseOx. This is actually been certified. You can actually see the logo here that now knows that this has been a certified device. I'm just going to slip this on. It's relatively easy to see. Turn it upside down so you can actually see the device. And you'll see it here as it goes along and operates. It will actually load the data into the phone. This actually makes it relatively easy because now you don't have to have the consumer entering the data. You don't have to have it's machine to machine, so you get a higher degree of accuracy in being able to assemble and make sure the data was actually collected correctly. So you see the data is now in here. This actually now is plugged into a Health Vault account on the back end, so we're just showing it demonstrating to a personal health record. But it can very easily be plugged into an electronic medical record or a healthcare information exchange. So this makes it very easy for us to assemble ready-to-use ready-to-use design systems so that we can now plug them into different systems for diabetics, for chronic disease management, for long-term care individuals, or even for those who are healthy and well and are simply wanting to understand a little bit more about their healthcare. It makes it much easier to do.